There is so much happening right now with Medicare. It seems like every day some other news breaks. The biggest thing that just happened actually today is another Medicare supplement carrier decided to stop marketing for future clients to come into the company. Doesn't mean they're going out of business, doesn't mean that anybody that has these Medicare supplement companies are going to lose you and make you go somewhere else. That's not the case, but it does mean there's no one else coming into their existing risk pool. How does that affect you? I'll get into that in just a minute. Then United Health, there's a lawsuit coming from, it's an SEC filing from people who had stock with UnitedHealthcare that feel like they were misled because of something you just don't want to miss. So who are the three Medicare supplement companies that in the last 3 weeks have said they will no longer take on new clients? And what does this mean to you? The companies are Manhattan Life, that was about 3 weeks ago. Last week was ACE, and they're owned by Chubb, one of the biggest insurance companies in the world. And then just today, Allstate Medicare Supplement announced they will no longer be taking new clients either. So what does that mean? It means a lot. And someone just opined on another social media platform that it doesn't mean anything to you. They said that your Medicare supplement client is no longer bringing in new people. It may not have any impact on your future rate increases at all. I highly disagree. I've only been doing this for 27 years, but I'm starting to get the picture of what happens with Medicare supplements and what affects those rates. And then just this morning, the middle one there, ACE, announced a rate increase, the first one since this announcement that they're not taking on any new clients with ACE anymore. That rate increase was 38%. This is in the state of Nevada, only for Nevada, but it's an indicator. And it said that the rate increase for Plan G and Plan F, which I've talked a lot about, if you don't know the difference, Plan G, Plan F, Plan N, Medicare supplement, there's a huge difference. But Plan G and Plan F going up 38%. 38%. Can you imagine that? Your rate going from $100 to $138 just like that overnight. But on Plan N, it's going up 28%, which, yes, that's still horrible. It's a bad rate increase. But what does that mean? It means the differential between Plan N and Plan G, in this case, is 37.5% difference between the rate increase for Plan N and the rate increase for Plan G. I've been talking about that since 2018, and still people on this platform think, oh, is he right about that? I don't know. You can look at that at plannmedicare.org. You can see why I've been predicting this since 2018 and why it's been proven right over and over again. Can I put that up? Yes, plannmedicare.org. If you don't know the difference and you're wondering which Medicare supplement should I consider going forward, should I be on the Plan F? You should long time get off of that. Should I be on Plan G? If you don't mind these kind of rate increases and you can afford your Medicare supplement, just think of it. If you had a 38% compounding rate increase for 3 years, could you still afford your Medicare supplement? How long do you plan on being on Medicare? The problem is if you can't get off of that plan in the future. So I think when we help somebody when they're turning 65 and we look at their entire career that they're going to be on Medicare, we should look at the long-term difference, not the short-term simplistic plan that says, go with this plan, it pays for everything. You don't need to learn about any of those other plans. We've never been that way, thank God. So what else is happening? These Medicare supplement companies aren't taking in any new people. What that means to you is, yes, if you can change, you might want to consider getting with a professional that can tell you what those options are and tell you if you can go through those options in your state. Because the Medicare rules of changing Medicare supplements, they're changing a lot in many, many states out there. So we are just one shop that could help you with that. And I'm not saying run for the door right now, but between now and your annual increase, you should be talking to an agent to see what your options are in the marketplace. And if you're able to move through underwriting or birthday rule or anniversary rule, depending on your state, that is something that I would recommend looking into just based on experience and seeing what has happened in the last few years. When companies like this decide that they're no longer taking in new people, their risk pool then begins to shrink and shrink and shrink. And those people who can get off of that sinking ship, it's just my word for it, they do. And that means that the healthy people that can then get through underwriting to go elsewhere do go elsewhere. And you don't want to be left in a pool with just older and sicker people. That's just my opinion, and it's served me and 20,000 other people very well in our tenure doing Medicare. So what's going on with UnitedHealthcare? A lot. In just the last couple of days, they fired their CEO, and they're doing a whole bunch of revisions to what their annual earnings were going to be. And here's how it was covered in the news.
Guidance poll. I want to talk about the change at the top, though, because it's interesting to see a boomerang CEO here, one that is 72 years old, really underscores the issues that this company is facing.
Yeah, it really shows some of the control he's had of the board and the influence he wields, that he's stepping back into this position, and that's happening so abruptly. This caught, obviously, the market and investors off guard. It is maybe not surprising that when he was starting to run into trouble, the earnings outlook downgrade, which now has all been pulled, was a big disappointment. And they've had some downgrades in the past year and change, which is very unusual for United. They've been kind of a beat and raise, really steady Eddie growing stock for a long time. So the fact that he was in trouble doesn't seem to be a surprise to the market, but the fact that they made such an abrupt and quick switch and bringing the chairman to this permanent position was really surprising. And I think there's still a lot more for us to unpack here as we report this throughout the day.
So what has been...
Oh, there's a lot more to unpack. And this is probably the only channel you're going to hear about it. It's very interesting.
I mean, obviously, there was the tragic murder of the unit head that got everyone's attention. But that is not what's driven the drop in the shares over the last month. I mean, they're off 40%, not even considering what we're looking at in the pre-market. What's the problem at UnitedHealth?
Yeah, there was a big reaction, obviously, from the public after that murder. It was obviously a tragic event the company had to reckon with. But what's really been pressuring them from a financial point of view has been Medicare. And they've been bringing in a lot of customers in Medicare, and they just haven't been pricing it correctly. And so these customers are needing more care. They're needing more medical treatments and services than the company has basically budgeted for. And so this is a persistent problem. It's not going away. They're trying to explain why that might be happening, but the explanations aren't keeping up. The numbers aren't keeping up. So the fact that they had to pull their guidance is just a glaring indictment of the fact that they couldn't pull that off.
Glaring indictment to the fact that they couldn't pull that off. They're saying that this is something completely shocking. It's just something brand new, but I want to bring you a different angle on this. And I've got the documentation that we'll talk about. And it really should concern everybody that's on a Medicare Advantage plan, especially if that plan is with UnitedHealthcare. So there's a brand new federal lawsuit that has just been filed, and it centers on one disturbing issue, and that is the denial of care to seniors on their Medicare Advantage plan, all for corporate profits. But before I go any further, I just have to say, let me be crystal clear. These are just allegations in a lawsuit. Nothing has been proven in court yet. UnitedHealth has not responded to the claims, but if what's alleged here turns out to be true, it reveals a massive problem with how Medicare Advantage plans may be operating behind the scenes. Fan in my eyeball. Sorry about that. This lawsuit was filed on May the 7th in the Southern District of New York by an investor, and he says that UnitedHealth misled the investors by keeping quiet about a huge problem, denying claims at shocking rates, he says, even when patients really needed the care. It's called a securities class action. And what's different about this is they're suing because the stock price went down. But don't let that fool you. The entire case centers on what's happening inside UnitedHealthcare's Medicare Advantage division, allegedly. So let me read you a few lines straight out of the complaint so that you understand how serious this is. UnitedHealthcare, this is right from the lawsuit. UnitedHealthcare dismissed about 1 in 3 claims in 2023, the most of any insurance company. That's twice the industry average. Dismissed means didn't pay the claims. 1 in 3. Now, that's not just a statistic. That could be your cancer medication, your physical therapy, your skilled nursing facility stay. The lawsuit goes on to allege that this just wasn't happening by accident. It claims that UnitedHealth had an intentional strategy to deny care in order to pump up profits, which is what the stockholders want, and keep their shareholders happy. Here's another one. Quote, denial rates for post-acute care services were approximately 3 times higher than the company's overall denial rates. Post-acute care is something I've talked about for years with Medicare Advantage in general. Matter of fact, my 5th grade teacher is in post-acute care right now. Bless her heart. She's one of our clients, love her to death. She fell in her bathroom, broke her arm, was found a day later, went to the hospital for surgery. Now she's in the rehab afterwards. Thank God she's on a Medicare supplement plan, because I know the difference. And this is the biggest glaring problem with Medicare Advantage that there is. Skilled nursing upon discharge from a hospital. It's a major problem. And they're saying here that the denial rate was just crazy. So this isn't just a moral issue. It's a legal issue now. The lawsuit says that UnitedHealth stuck with these denials even after the government scrutiny, the public outrage, that is, until something terrible happened. I don't know if you remember, but in December 2024, Brian Thompson, who was the CEO of the UnitedHealthcare division, he was murdered on the streets of New York, actually going to a conference where they're going to talk about their numbers, a financial conference. And the news reports said that the motive was anger about the denial of care. And no motive has been officially confirmed by law enforcement, but this lawsuit includes quotes from the BBC, the Boston Globe, and even Reddit threads showing that how furious people have been. If you just look on YouTube, you can see how angry people were at UnitedHealthcare about how they did their claims. There's another quote from the lawsuit. Quote, UnitedHealth had for years engaged in corporate strategy of denying health coverage in order to boost its profit and ultimately its share price. Now, here's where it really may affect you. After the murder and after the backlash, the lawsuit claims UnitedHealth began to quietly change how they handle claims. And that's what they're talking about in these news stories. Let me just show you another one for some context here.
Health says Andrew Whitty stepping down as CEO, saying for personal reasons, board chairman Stephen Hemsley is taking over. They miscalculated on something, and then you had,
Well, and Scott Gottlieb talked to us about the idea that the expenditures are going to be much more than they had calculated,
and I would
which is surprising.
If you look up UnitedHealth CEO, the Andrew Whitty doesn't come up. It's all about the poor guy that was.
By the way, he's saying he's leaving for personal reasons. Think about the stress of what the last year must have been like.
Right.
I mean,
probably,
genuine stress. On so many scores.
Right. Probably looking around a lot before he gets out of a
coming up.
So the allegation is that they have started approving more and more claims, pulling back on those denials that they had been known for before. But here's the kicker. They didn't tell the investors they're going to start paying more claims. They continued projecting high profits for 2025, knowing that their costs were going up. So in April of 2025, the company had no choice. They had to revise their earnings forecasts and admit that they were spending more on patient care. So before this happened, their stock was $29.75 adjusted earnings per share. Afterwards, it was down to $26.25, a drop of $3, and the investors just panicked. So UnitedHealthcare stock went down 22% in one day. Let me break that down plain and simple. If you're on Medicare and you're on a Medicare Advantage plan, which is not original Medicare, the insurance company is getting a fixed amount of money for you every single month from Medicare, because they're taking you off original A and B and they're putting you into a privatized system that they call Advantage. So obviously, if they're getting a set amount of money, what they spend on you in claims determines whether or not they make a profit. So the profit goes up if they spend less and less on your care. That's the difference between what they get and what they have to spend. That's called net profit. That's the design of Medicare Advantage. And this lawsuit claims that UnitedHealth got too aggressive denying care that should have been approved originally. Then they got caught, it's saying, when public and legal pressure forced them to back off. And when they did back off and they started paying for more services, then their profits dropped, which is exactly what the lawsuit says they tried to hide. I've said it before and I'll say it again. Medicare Advantage plans work great for some people, but they also put a corporation between you and your doctor. And when that corporation has to answer to Wall Street first, then it creates a dangerous conflict of interest. So this lawsuit, if it's proven, which it hasn't been, then it would show exactly what that conflict looks like in real life. just to be clear, this is an ongoing case. Nothing's been proven yet. United Health deserves this day in court, of course. But you deserve to know what's being alleged here because it could affect your care. If you've had a claim denied, if you're unsure about your Medicare Advantage plan, or you just want to talk about other options when it's your time to do so, or if you're turning 65 and you've met with Medicare agent after Medicare agent or called into a call center and they've never yet explained to you what even Medicare supplement plans, Medigap plans are, that's because there's a huge bias in our world of insurance. The bias is Medicare Advantage plans pay us a lot more in commission, double the commission if you're just turning 65. They want to get you onto that plan. And so the Advantage companies are able to heap that commission on you. They literally call it heaped commission. You get double the commission. And next year, there's a proposal that in California could go up to over $800 just to get you to sign up for a plan that doesn't cost you any premium. So why is the incentive then on the agent to tell you, but wait, there's another choice besides giving up your original Medicare to go on Advantage and go private, where they make your healthcare decisions for you. You could stay with original Medicare with no network limitations, no restrictions on care, no referrals required, no networks to look up. That's original Medicare with a Medicare supplement plan that fills the gaps of original Medicare, making it a complete package. And yet a lot of agents are just not talking about that as an option. So if you want a second opinion, that's why we're here. Just don't wait too long to make it too late for you to get stuck in a plan that you didn't read the fine print on. That's the only thing I'm asking for you is do the research, get a second opinion, share this information with people who are on Medicare or approaching Medicare so that they know where they can stay informed and stay protected by knowing what's happening in the industry. Not saying this lawsuit is real. I'm not saying that the allegations are true. These are just investors that are literally the owners of this company saying, you were denying care before, our profits were up. You started paying claims because of public pressure. Now our profits are down, and you didn't tell us what you were going to do that's going to affect our profits. That's what the allegation is. Of course, we'll continue to monitor this and all the stories having to do with Medicare. But if you're on one of those Medicare supplements I talked about before, you pull it up again so you can see it. And if you're concerned about possibly what's going to happen to your Medicare supplement plan, you really should give us a call and put up the number so you can actually see to do that. It's 800-729-9590 is our phone number. 800-729-9590. We've now reached the milestone where we've helped 20,000 people across the entire United States with their Medicare by answering their questions. And what that means is we've talked to over 100,000 people, and 20,000 of them said, you know what, because you helped me, because you gave us value, let me go ahead and go with you as our Medicare agent. And it doesn't cost you anything to do that. So you can either spend all day at Medicare.gov trying to sift through information that actually may or may not be relevant today because it's stale by the time it gets there. Or you can depend on a licensed insurance broker that's independent, doesn't work for any one insurance company, whose services don't cost you a dime. That's what I encourage you to do. I'm going to leave you with a voiceover of a review that we got just a couple of days ago on the Better Business Bureau. If we can help you, please reach out and check this out.
Notified that my Medicare supplement insurance company was stopping business for new customers and could lead to large rate increases. Christina helped me and my husband both sign up for a different company. I'm saving $20 a month, and my husband is saving over $100 a month. We had a great experience going through the process of questions, etc., with Christina. She has a great personality and attitude, making the mundane fun but efficient. We are very grateful for her and the Senior Savings Network. We still have our current vision, dental, hearing reimbursement insurance with them, and have been using it about 5 years. Initial review several years ago. I found this website by watching Chris's informational videos and was convinced that he was truly trying to help people get the Medicare policies they need that will serve them best. I've had lots of retired friends tell me what plans to get and where to go. I've seen how 2 places instructed my husband and wasn't impressed. Also, had to drive a while to get to these places, and with Senior Savings Network, you talk on the phone, and follow-up emails are very helpful. They email reminders about appointments, and you have access by phone and text for questions. I talked with them several months before needing to make decisions, so they set up an appointment and reminded me of it. Kendall was very helpful, gave clear, concise information. I am set to go before I will start using Medicare, supplement, and drug coverage. I feel that she took my personal health situation in consideration when making recommendations. I feel you can't go wrong by talking with these people,